All right, everyone, it's Bleav in Vikings. Today, Tuesday, August 13th, and I'm your host, Mike Wapshall. Excited to be joined again today by a special guest. We're going to have Dr. David Chao joining the show so we can talk about the JJ McCarthy injury, and maybe we'll clean up a few other things too on the Vikings roster and see what Dr. Chao has to say. You can follow Dr. Chao on X, on Twitter, at Pro Football Doc. So excited to bring him in and have a conversation with him about JJ McCarthy. First, though, Bet Online is the world's most trusted betting platform and your number one source for everything online sports betting. Right now, you can receive a 50% free bet of up to $250 on your first deposit to bet on anything from baseball to Formula One racing. Bet Online has every stat, every matchup, and even live odds and spreads while the games are being played. When a game's over, head on over to their online casino and get in on a game of blackjack or poker or unwind with one of their over 150 slot games. Head to the website today to get in on the action. Use promo code Bleav for your 50% free bet credit on your first deposit up to $250. Bet Online, the game starts here. Dr. David Chao, we welcome you into Bleav in Vikings, and it's a pleasure to speak with you and meet you. Unfortunately, though, it's not for good news for Vikings fans because it has to do with their injury to quarterback JJ McCarthy. Now, I just started watching your full breakdown and analysis via X on your website, and then you beeped in here so we could chat. So I need to hear it straight from the horse's mouth, Dr. Chao. What were your thoughts on it?
Well, Mike, good to connect with you. You know, we chatted briefly a little bit, never really met before, but crossed a lot of paths here. I was a team physician assistant for the Vikings well before your time in Minnesota.
Is that right? Okay.
Yes. I mean, back in the day when I spent 17 years as the Chargers head team physician, but I was a Vikings team physician. You know, back in the day when Warren Moon was the quarterback.
Okay, so you're talking mid-90s.
Mid-90s. Chris Carter was a wide receiver. Randall was your
John Randall.
John Randall was a new defensive end, and I'm blanking on his name. The Pro Bowler, your guard.
Randall McDaniel.
Randall McDaniel was there.
Oh yeah.
A lot. Robert Smith was there. And Dennis Green was the head coach at the time. That's the era. And we talked about knowing Mike Tice. I see him a little bit, right? And you mentioned Mike Zimmer. I don't think Zim likes me as much. There was a press conference once, and he opened up, and they were asking questions about a player, and he immediately said, "Well, that TV doctor was wrong." And I was like, "Well, how do you know he means me? I'm not on TV. I mean, I watch TV and look at things. So it's all good. It's all good fun."
Well, you know, head coaches, they don't like talking about injuries, Dr. Chao. You know that better than anybody.
Well, I'm glad that, we've talked about for years. Look, I don't dislike coaches. They're doing their job. Remember, I was on the other side of coach speak, where what should we say or this kind of thing. So I don't begrudge anyone. On our Bleav podcast this week, I actually interviewed as our guest the Coach Speak Index guy. The guy who rates coaches on Coach Speak. And for years, we've been talking about injury Coach Speak and reading between the lines and what have you. The coaches are just doing their jobs. And of course, they don't like their injury information out there. But this is why I think we have a purpose at Sports Injury Central, sicscore.com. And this is why we're talking here. We're really the only place with injury analysis. Everyone else is injury reporting. So the injury reporting on JJ McCarthy is right knee, MRI showed a meniscus tear, and needs surgery. That's the reporting. So we're here to do the analysis. Of course, there's no video, so I can't tell you any more on that side of it. And full disclosure, I deep down inside, I do love the Vikings from my time in Minnesota and some Vikings roots and so forth. But also your head coach, love your head coach, Kevin O'Connell.
Kevin O'Connell,
San Diego State kid. He was at San Diego State when I was the Chargers team physician. We crossed paths a few times. He's smart kid. I call him a kid. He's not a kid anymore. He's a kid to me, but he'll do the right thing by JJ and develop him well. So that's what we know. So here's what it means. Okay. You never want to hear the word surgery, but Vikings fans, hold in here. There's a silver lining, and I'll get to it. Okay. Not good news that the MRI is positive. His recovery timeline will depend on what type of meniscus surgery. In media, people say all the time, he's undergoing a meniscus repair. And I see a lot of media, the extent of the repair. That's not accurate. There is a big difference from meniscus repair, where you're sewing something and now need healing, two pieces of tissue to grow together, versus meniscectomy repair, fixing something but trimming it. The difference is you can climb a tree as soon as it's been trimmed, but you can't climb a tree if it's been transplanted, right? You got to have the roots grow in.
Sure.
You can play football on a grass field as soon as you mow the lawn. That's a meniscus trim. Now, of course, your knee needs to feel better, but that's a different story. You're not waiting for anything to heal. But if you lay down new sod, you have to keep off the grass and let the roots grow in. So it really depends on JJ McCarthy. Is this a repair or a trim? Now, back in my day in the NFL, there was actually a poll of athletes. Would you choose to have your meniscus repaired and miss the rest of the season, or choose to have it trimmed and returned in 4 weeks? 95% of NFL players said trim. But here's where that's not accurate. There are certain types of tears. So this goes back to, the old days. Ronnie Lott cut off his finger, right? But it's not that binary. The vast majority of meniscus tears cannot be sewn or repaired, and so it becomes a trim. It's natural. There's no real choice because it doesn't heal well, lack of blood flow. Certain types of meniscus tear, and believe it or not, it's the bigger types, the bucket handle types, are amenable to repair. I have not spoken to JJ McCarthy. I'm not his doctor. And if I had seen his MRIs, I wouldn't be able to say anything because of HIPAA. But I would strongly advise him, if you were a patient and it was a meniscus that was amenable to repair, to not worry about the return timeline and go get it fixed /sutured /repaired, because you're a rookie, longevity, arthritis, it's worth it. Now, it may not be his choice. It's a different type of smaller tear, trim it and let's go. But that's the big determining factor. The majority of time, it's a meniscus that can't be sewn and it's trimmed. And then, you're looking at 4-6 weeks. But if it is sewn and repaired, a true repair with sutures, and beware of media using the word repair when they don't know the medical side of repair, then it's really his season. So we'll wait and see. Now, I don't mean to keep going on soliloquy here, but then, Mike, you and your fans will probably say, where's the silver lining? The silver lining is, it's, in my opinion, it's never great to rush a young quarterback into action. This gives him a chance to take a deep breath, to be in film study, to be in meeting rooms, to be there with the clipboard, where there's no pressure for him to come into a game because he's recovering from it. In division, perhaps, you look at in division, the team that's had the most quarterback success over time has been what? The Packers, where Aaron Rodgers waited to start and play, where Jordan Love waited to start and play. And nowadays in the NFL, you don't always see that. So I always look at the upside or the glass half full. The silver lining here is I do believe JJ McCarthy will ultimately be fine. This isn't long term. Could it be season? Maybe, if it's a repair, but that's not the worst thing for him, in the big picture and the long run, right?
So is the surgeon and doctor going to discern that in the middle of the procedure, or do you think they have a good idea because of the pictures they can see before they go in?
Usually you have a good idea before you go in, but there are sometimes cases where things change. It's like in a football game, you have an offensive game plan when you go in. And when you break the huddle, you have a play call that you have in mind. But sometimes there's an audible based on what you see, etc. But yes, you
Okay.
clearly have a plan. And I
Yeah.
guarantee you the doctors have already discussed this with JJ, his family, his agent, or whatever. What I typically do is say, I'm going to do what's right for your knee, what's right for your knee in the long term. And if
Hmm.
it's something that is clearly amenable to repair, but will have you out longer, I think we should do that for you. If it's clearly most amenable to trimming, we'll do that for you. The only question I have for a patient is, what if it's borderline? Do you want me to
Yeah.
lean towards short term or towards long term?
Right.
So usually it's only a small percentage of cases where the patient, quote, decides, kind of thing, because usually it's clear this is what's best for you, this is what's best for you. But in the middling area, there might be a time. So that's probably what the discussion was.
So what's like is the is JJ gonna be alert and awake when they're looking at his knee and doing this? Can they, and this might be a silly question to you, Dr. Chow, but can they ask him? you know?
Um, no, for this
Okay.
reason. Typically, no. First of all, you're not awake. Now, could it be under a spinal? Sure. But you've also been medicated, probably, right?
Uh-huh.
So it's not routine to ask the patient in the middle of. Now, the patient can look, if you're under 18, there are times, and it's really, we need to decide, and it's really that big of a deal. I've told
Mhm.
parents you should wait in the waiting room. If it's that touch and go decision time, I'll break scrub and come out and talk to you because the adults have the decision making. Could JJ cede that to his mom and dad? He could, but it's just not that common to need it. Now, I say that, but there was one player, and he gave me HIPAA permission to talk
Okay.
about it, who had a meniscus tear and ACL tear before the AFC championship game. But he was so firm in telling me, take it out, don't repair it, take it out. At the time, he was, I don't know, 24 years old. I said, no, I want to repair it if it's repairable. I don't want to take it out. And we had a argument over it. I want to do
Wow.
what's best for you. And so I actually scoped his knee under a local to show him the tear with the
Jeez.
idea of convincing him, you need to look at how big this is. You need to let me repair it for you and do what's right for you.
Yeah.
But when we got in there, it was bad enough that it needed to be trimmed. And so then we just put him to sleep and we trimmed it. But
Mhm.
and he played 6 days later in the AFC championship game.
Jeez, that's incredible. I mean, and so in a situation like that, and we're getting off topic on JJ a little bit here, but in a situation like that, you're dealing not just with the function, but also with pain management, I would have to
Pain
think.
management, but you also have to deal as a doctor of long term what's best. It's not always just about this week or this year
Yeah.
or this 5 years, right? And so that's sort of your job to do what's best in the best interest of the patient and explaining everything long term.
With with more, I guess, significant, at least in our minds, significant surgeries that have to do with major ligaments, ACL, MCL, or maybe something in the shoulder, there's always a question of, are they going to be the same when they come back, right? Are they going to be as quick? Are they going to be as agile after an ACL repair? Do you have those same sorts of questions or concerns when it's a meniscus?
Not really. Not
Yeah.
in a player's lifetime. Let's say it's a bad tear of the meniscus and he loses all of the meniscus, JJ McCarthy. Yes, he's more likely to develop arthritis. And we don't know right now, is it a medial or lateral meniscus? That can make a difference. But yes, he's more likely to develop arthritis in the long run. But,
Yeah.
I get it. Some quarterbacks play into their 40s now, but still, that's considered quite young in the medical world. And
Hmm.
I don't see how this meniscus tear will overall affect JJ McCarthy's NFL career much, if at all. And
Yeah.
if you're talking about this season, huge effect, even if it's a trim. But if you're talking about his career, I would say this meniscus will have no effect, or quite honestly, silver lining might help him, right?
Sure.
In terms of, giving him time to develop.
Yeah. Development. Yeah. And I think they had that sort of insulation with Sam Darnold anyway, because they're paying him a really good salary. I think the expectation was Sam was going to be the starter. So I already think that there was less stress and strain to get McCarthy in there, but this only adds to that. I think you're totally right.
And look, I know Jim Harbaugh very, very, very well. And, I know Michigan kids are smart. And I saw JJ McCarthy drop his Latin on the world and proving he's a smart guy. And smart guys are going to do what's right for them in the long term, not take the shortcut. So if it's amenable to repair, I think he will do the repair. And if it takes all season, so be it. But sometimes there's no choice. So we'll see.
Last thing here on JJ, when he procedure over, when he starts working his way back into physical activity, what's the process for him there? Is it long? What are they going to be having him do? Is it side to side? Is it
a lot shorter if it's a trim? I'll give you a nugget here for Bleav and for you, Mike.
Yeah.
If you wake up and you see him in a big leg wrap, or any leg wrap, that's normal. But if you see him in a brace with metal stays, that's a meniscus repair. You don't even need the reporting. If there's no brace on, that was a trim, and it's the quicker one. If he's in a brace, look, crutches aren't going to be able to tell. You give everyone crutches just in the beginning. But if he's in a lockable brace, hinged with metal stays, that was a meniscus repair, and he's out for the season.
Interesting. I'm gonna ask you about two other ones, and if you don't know, you don't know, but I'm gonna ask you about it.
Okay.
TJ Hawkinson, Christmas Eve, ACL, MCL. They waited, I believe, 4 or 5 weeks for the MCL to heal, then did the ACL. He's on the field doing stuff on the side. What are you thinking there? The Vikings have a bye week 6. Do you think it's a week 7 return?
Well, return to play is always a lot of factors. Mm-hmm. Return to play is multifactorial. It's the player, the team, and medical. This goes for TJ Hawkinson. It goes for JJ McCarthy. It goes for anyone. You need that to be unanimous to return to play. The player, the dad, the agent, or whatever has to feel like they're ready. The team has to feel like it's a good idea based on schedule, timing, roster management, and we've seen you do enough. Sometimes contractually, they'll hold the guy longer or push him more. And medical, whether it's the surgeon, the athletic trainer, the team doctor, it needs to be unanimous. So let's say this. Let's say TJ wants to go, the team wants him to go, but the medical says no, he's not going week 6. If medical says yes, the team says yes, but TJ says, I don't feel right, he's not going. So when will it be unanimous? I can't look at a crystal ball, but I will tell to your fans, if you go to sicscore.com, Sports Injury Central, we have an 80-page preseason preview of all teams in the NFC North and of the Vikings. So there's literally 2 pages of information, and there's a full write-up on TJ Hawkinson. The hint of it is this. If he's ready week 6, that would be great, but there is no way that he's TJ Hawkinson at week 6. If he can get to be TJ Hawkinson by the later half of the season, fans should take it. Is it possible for him to play week 6? It's possible, but I don't see him being full TJ Hawkinson at that point in time. So we have a relatively low, what we call SIC score, Sports Injury Central SIC score for his health for the season. And for fantasy drafters, you might want to wait a little bit and let your opponents draft him. There are better medical options right now for this season.
It's pretty unprecedented to have any other timeline other than that, Dr. Chao. The exception, and I saw it firsthand, was Adrian Peterson, who was the rushing leader and MVP the following season after an ACL tear in 2012.
There's no question, and that's what makes people think that that's the norm. That's not the norm.
No.
AD is not the norm there. And, he was a very unique style of power and cutting ability. and very unique. And hats off to him. He gained 2,000 yards after that season.
Yeah.
The
Yeah.
interesting thing is that year Jamal Charles of the Chiefs gained 1,500 yards, but no one cared about him because of Adrian Peterson, right, and what he
It
did.
was unbelievable. Yeah.
That's the norm. At Sports Injury Central, we said when Saquon was coming off his ACL with the Giants, don't draft him. This is not a good year, and he had a terrible year. And then the second year back from ACL, we said draft him. He's going to have the bounce back. That's the norm. What Adrian Peterson did was not the norm. So maybe TJ Hawkinson can do what Adrian Peterson did, but that's not the norm.
Yeah. Really, last thing, Dr. Chao, is Vikings cornerback Shaquille Griffin has been out, and it is being termed a soft tissue injury, and it's a leg injury. Not on Shaq specifically. Generally speaking, when we read or hear soft tissue, what does that mean?
I mean, it's typically a muscle injury. It could be a tendon injury as well, but it's usually a muscle. Is it a hamstring? Is it a quad? Is it a calf? Don't know. And the hard part about preseason is what we do, be it on my Twitter, Sports Injury Central, we deal in insider knowledge, not insider information. We talked about Eric Sugarman with the Vikings. We knew each other very well, but I never picked up the phone to say, "Shug, what does this guy have?" He'd hang up on me. I know your team doctors very well. They don't tell. So I look at video. In the preseason, there's no video, right? It's not filmed, all the practices and games.
Yeah.
And muscle injuries are hard to tell anyways. That once again, going by my glass half full, you'd much rather have that now than in week one. These are early season acclimation injuries. At least you can hide multiple weeks of the soft tissue injury within training camp, as opposed to have it pop up on week one and then missing a bunch of time in a bunch of games. And obviously at his position, you need to be near 100% on your hamstring, quad, or calf, or whatever it is to be able to cover the field.
Yeah. Awesome. Really enlightening and interesting conversation, Dr. Chao. I've heard you for years, particularly on SiriusXM NFL Radio, Moving the Chains with Jim. So I enjoy your work very much. I do follow you on X, and everyone else should as well, at Pro Football Doc. And then your website again, Dr. Chao.
Sports Injury Central, which is sicscore.com. And I'm telling you, 80-page free preview. You don't need to read all 80 pages, but Vikings fans might want to look at the Vikings section, but also the Packers, the Lions, and the Bears section. Right there.
Very interesting. Awesome. Well, thank you, Dr. Chao. And when I run into Sheldon Burns and Joel Boyd, I'll tell them hi for you.
Sheldon is my guy, okay? I love Joel Boyd. Sheldon, okay. Can I say this? Will I get in trouble? Okay.
No, you can't get in trouble. You're Dr. Chao.
Love Sheldon Burns. I mean, love him. Joel Boyd is great. I mean, is great as well. Joel played football, right? I mean, football player.
Absolutely.
Sheldon, my favorite. Sheldon is his family practice doctor, and I helped him out with the Timberwolves as well when you're there. And one of my favorite memories of Sheldon, besides he's the funniest guy in the world. You know this, right? I mean,
I do, yes, without even trying.
Oh, it just comes naturally. He's the best. He'd sit there, he'd show up from his practice, and the game would be about tipping off, and he wouldn't have dinner yet. And he'd go eat a salad, okay? And you think he's healthy. And he would sprinkle sugar on the salad. I guess it makes sense. A lot of salad dressings have sugar in it already. But he's looking healthy. He's eating a salad, but it has sugar on it. And you know what his table was? Top of a tray on the top of a trash can in the Target Center where you could see the game.
That's awesome.
Sheldon's the best. Love.
Not surprised.
Right? I mean,
good people. Lots of good people around there. I know there's many more that you know that I don't from your time here, but very cool.
This is probably ahead of your time, but you realize your Fred Zamberletti is the only athletic trainer that's been the Hall of Fame for a team, and he's still up on the Ring of Honor or the Hall of Fame, whatever you guys call it. And when he retired, he was the only athletic trainer the Minnesota Vikings ever had when he retired. He
Yeah,
started
that's
with them day one and then retired with them. Fred's awesome too. Fred was
unbelievable.
still there when I was there in 94 or 5, and Chuck Barta
Yeah.
was assistant. He went on to
Yeah.
be the head for a while before Sugarman came in. So, yes.
And Freddie was a great storyteller, and
Oh,
he had a lot of stories, and he was good at it.
oh, and he's old school. He knew what he was doing too. One of my favorite Freddie stories is he'd come over here. He'd look at somebody at the combines, right? Come here, young man. It's there. And the player would come over. I want to shake your hand.
Yeah.
Shake his hand. And I was like, what is he like? He's not being fanboy. I know that. What he was doing was assessing their bone structure. Is this
Amazing.
guy a guy who can hold his weight, or is he a small frame guy based on his hand size that worked out a lot and put on weight, thus more prone to injury? Or is he have the frame and axle? And that's what he was doing, shaking their hands. Fred's awesome.
Yep,
Love
that's
Fred.
a great story. Great tidbit on Freddie Zamberletti. All right, Dr. Chao, I'd love to stay here and chat with you longer, but I'm sure you have appointments to keep, and we'll get everyone out of here. Again, thank you for your time. Much appreciated.
Thank you. Bye-bye.
All right, that's going to do it for today's episode of Bleav in Vikings, everyone. We thank you for listening. Remember to like, subscribe, and follow Bleav in Vikings. You can find us wherever you find all your other favorite podcasts and football content. That's it for today, everyone. Until next time, always remember, keep believing.